Just select أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين اللهم صل على سيدنا مولانا محمد وعلى آله سيدنا مولانا محمد وبارك وسلم. So, Jazakallah khair for joining. Sister, welcome, and everyone who will be who is listening and will be asking questions. Welcome to the mental health awareness session for the month of November. We do it every third Saturday at 11:30 a.m. Alhamdulillah, the goal for this is how we can spread the mental health awareness in our community. This is basically the primary intention. We want the community to know that there are resources available. Mashallah, there are, of course, people out here in our community that do work in this profession, and they really want to help see service this community. So this week we have Sister Sara Bawany. She is LCSW CCM, and that is basically a licensed clinical social worker and award-winning published poet, mashallah, and a freelancer, and she's based in Austin. She's a therapist and works in a private practice. She works with young adults struggling with different issues. And I'm very glad that I believe she moved from Dallas very recently. Is that right?
About a year and a half ago, yeah.
Yeah, so welcome to Austin. This is what we call home, and we welcome you to our family.
Thank you.
And inshallah, today we're going to discuss about an important topic, what to know when seeking mental health support. I know that mental health itself is something that we need to raise awareness, but this is a first step. How do we know? What do we need to know when we're seeking mental health? So I hand it over to Sister. Welcome, and please show us what it means.
Right. Assalamu alaikum, everyone. Bismillah ar-Rahman ar-Rahim. Assalatu wassalamu ala Rasulillah wa ala alihi wa sahbihi ajma'in. I am going to share my screen and we'll go from there. Okay. Oh no. There we go. Can Brother Altaf, can you tell me if y'all can see that?
Yes.
Okay. All right. Assalamu alaikum, everyone. As Brother Altaf said, my name is Sara Bawany. I'm a licensed clinical social worker based here in Austin, Texas. I'm from Dallas, but I did study in Austin, so I do have a previous connection with Austin, and I'm really happy to be back here and, trying to bring mental health awareness to the Muslim community and serve in whatever capacity possible. So I figured I'd keep it a little bit simple today, just what to know when seeking mental health support, because I, as a therapist, get a lot of questions from general community members of like, they don't really even know where to start. There's a lot of terminology, there's a lot of acronyms and licensure, and there's just so much knowledge to navigate around when, trying to find a therapist or a counselor or a psychiatrist. And so I wanted to see today if I could sort of break it down for everyone and try to help bridge some of those knowledge gaps that some of us may experience when trying to seek mental health support. So just a little bit about me. I graduated from the University of Texas at Austin in 2017, so about 4.5 years ago. I did my undergraduate degrees there in biology and Islamic studies, and then went a completely different path and got a master's of science in social work. And so my master's degree is in social work, but my licensure is a licensed clinical social worker. And so those are two different things that we're going to talk about in a little bit. So I'm originally from Dallas, Texas. I popped around a little bit, but I do claim Dallas as home and now Austin, alhamdulillah. And, one of the reasons I went into social work amongst all the different, paths and professions and, degree plans for trying to work in the mental health field. Number one, UT Austin only offered a social work program. And so it really was pretty clear to me that I didn't want to leave Austin. I loved it here. And I really wanted to study at my alma mater. But more importantly and more deeply, And like we're going to talk about in a little bit, social work is one of those fields where it does focus on mental health, but it also zooms out a little bit and looks more at the macro perspective. A lot of different, psychology and counseling degrees and professions very much focus inward on the person and are very, very person-centered, which is great and is important and has its place. But my interest was more so in sociology and systems and policy and community work and social work and social justice classes and whatnot provided all of those things. And for, from my background and coming from the Muslim community and seeing a lot of the different dynamics that the Muslim community deals with and has unique to its community, I felt that social work was one of those professions that would really help me be able to analyze those in a way that, would be helpful. So I do a couple of different things with my degree. Full-time, I work at an organization called FACE, which stands for Facing Abuse in Community Environments. And our aim is to provide education, knowledge, and other services to ensure community accountability. We focus a lot on the dynamics of power and control and how to make sure that our masjid environments and institutions aren't wrestling with too much power and control, that there's appropriate checks and balances, that there's policies and procedures and processes in place, specifically for when abuse happens in the Muslim community. And as we know, that's something that is becoming more and more of a prevalent issue that we are slowly learning how to talk about as a community. So that's my very, very big passion that I work on. And but that's for a different time. And then part-time, I work as a counselor with a practice called the Impact Counselors. It's technically based in Dallas, Texas. So I only work in telehealth. So I see clients virtually. And I do that part-time. And then aside from that, I'm a published author, poet, and writer, and that's another passion of mine. So when you see me on Zoom screens, there's a lot of different things that I end up doing, sometimes performing poetry or talking about mental health or talking about accountability work. So I do a lot of different things with my time, alhamdulillah. So I'm, again, really happy to be here and share all of that with you. So before we really dive into, what is mental health? What do we need to know? What are some of the things to navigate when seeking mental health support? I really want to touch on this topic of Islam's role in mental health. In my time working in the Muslim community, I've encountered so many misconceptions that Islam and mental health are two separate things, that there's no way these two concepts can really even bridge together in any way. And it's just simply not true, because Islam has a rich history of contributing to the mental health field. In fact, if you look up some of the writings of Ibn Sina, Al-Ghazali, etc., you'll see the term ilm al-nafs, which is more commonly known as Islamic psychology, but literally translates as the science of the self or the psyche. So during the Abbasid Caliphate from around 750 CE to around, I believe, the 14 or 1500s, the 8th to 15th centuries were considered the Islamic golden age. Some people call it medieval Islam, but there are so many contributions to science and math and art. And, so many of the scholars of the time were multifaceted. And, we always hear the term Renaissance men. Well, many Renaissance man or woman, and many of the scholars of the time were experts in multiple fields: mathematics, medicine, mental health, Islamic theology, and scholarship. And so, there are a couple of scholars and contributors that I've listed that specifically contributed to the mental health field. But Islamic psychology specifically, so it was the medical and philosophical study of the psyche from an Islamic perspective, and it addressed topics in psychology, neuroscience, philosophy of the mind, and psychiatry, as well as psychosomatic medicine. So mental health and mental illness at that time were viewed with a very, very holistic approach, as with most Eastern cultures. It emphasized a mutual connection between maintaining adequate mental well-being and good physical health in an individual. So at the time, and even now, you'd argue, so Muslims at the time thought it was necessary to maintain and believed it was necessary to maintain positive mental health in order to partake in prayer and other religious obligations. There were also many exceptions and legal protections for the mentally ill at the time. And there's a Quran verse, I didn't include it here, but there are Quran verses that talk about how to treat those who are mentally ill. It translates kind of over into the insane, but I don't think that's really the appropriate translation of the term. But there are a lot of legal protections listed in the Quran for the mentally ill. What a lot of people don't know is that some of the very first psychiatric hospitals ever created in the history of the world actually were in Baghdad during the time of the Islamic Golden Age and the Abbasid Caliphate. So I also wanted to highlight some of the major scholars and contributors of the mental health field. So I'm going to read a little bit about them. So number one was Muhammad ibn Zakaria al-Razi. He is known as Razis in the Western tradition, but he was an influential Persian physician, philosopher, and scientist, and among the first in the world to write on mental illness and psychotherapy. He was the chief physician of the Baghdad hospital and the director of one of the first psychiatric wards in the world, which was in Baghdad. Two of his works in particular, Al-Mansuri and Al-Hawi, provide descriptions and treatments of mental illnesses. The second is Abu Ali al-Hussein ibn Abdullah ibn Sina, which is popularly in the West known as Avicenna, but Muslims know him as Ibn Sina. So he was also a Persian polymath, regarded for his writings on diverse subjects like philosophy, physics, medicine, mathematics, geology, Islamic theology, and poetry, all my favorite things. And in his most widely celebrated work, The Canon of Medicine, he provided descriptions and treatments for conditions such as insomnia, mania, vertigo, paralysis, stroke, epilepsy, and depression, as well as male sexual dysfunction. And he was a pioneer in the field of psychosomatic medicine. So he would link changes in the mental state to the changes in the body. And then lastly, one of my favorites is Abu Zayd al-Balkhi, a Muslim psychologist and physician during the Islamic Golden Age. His many contributions were vital to the understanding of mental health, as well as how to treat various mental illnesses. He's famous for his work titled Sustenance of the Body and Soul, and he encouraged in it other physicians to treat the body and mind as a whole and take a holistic approach to medicine. This thinking is significant because it laid the foundation for psychophysiological approaches to healthy living. And in his writings, he explains that the soul experiences an array of emotions such as distress, sadness, and fear when the body undergoes physical illness. One of the things that he is most known for is creating a listing of a diagnosis for OCD, as it's known today, which is obsessive compulsive disorder. So he created a list of symptomology that almost exactly matches the DSM-5 today of what one would describe as OCD. So he was way ahead of his time. But a lot of these individuals are way ahead of their time, and they're not really given enough credit, both by Western media and medicine when it comes to mental health, but also by us. And I always start off all of my discussions and highlighting these figures because I think it's really important for us to know how rich our history and tradition is within our faith for mental health specifically. So in the hospitals back in the time, some of the treatments, including medication, would also be baths, music, talk therapy, hijama, otherwise known as cupping, and aromatherapy. So again, a very, very holistic approach to medicine and mental health that I love, and I get so happy every time I learn about, because I don't know where the disconnect happened between the Islamic Golden Age and where we are now, and where we lost that knowledge of how Muslims contributed to this field and did such a good job with it too. So mental health in the United States specifically. So now we kind of come back to where we are now. So my previous slide was to really show that this, term mental health and mental health support and therapy, these are not Western concepts. They have a very, very rich history and tradition within Islam. Here in the West, of course, as we know, there's a heavy focus on talk therapy, and there is more there's more of a push to integrate a more holistic approach that, again, was more often seen in Eastern cultures, in Chinese medicine, in medicine in, the Islamic Golden Age, etc. I think a lot of it was inspired by the Greeks and the Romans as well. But there, again, so much emphasis on more than just a 50-minute session and, some homework like you see in, therapy today. Another thing that I've encountered when analyzing the way mental health is approached here in the West versus back in the East, there's different emphases on whether the person exhibiting a mental health condition is to be focused on as an individual with an individual problem, or whether we zoom out and look at the systems and the environment that's created this problem. And so the West, unfortunately, is a little bit more focused on the individual problem aspect, but you'll see Eastern cultures and fields and disciplines like social work that are able to zoom out a little bit and factor in all the different things in an environment that are contributing to this, mostly so that the blame is not solely on the individual. You'll see, therapists and counselors in the United States having different approaches to that, but this is just something to look out for how how mental health is often approached. I also want to highlight the terminology counselor versus therapist. For all intents and purposes, those are almost the same thing. There are a couple of technical differences, but colloquially, the terms are used interchangeably. So I'm going to be using them interchangeably. I don't think it's as important to focus on that because essentially it's just different paths or terms that do the same thing. Now, in today's time, it's been really awesome to see, more prevalence of holistic approaches in Western mental health that are integrating more Eastern approaches. And there's finally increasing research into the Muslim community about the Muslim community specific needs. Even I remember I went into grad school as a social worker, and I remember trying to apply some of what I learned to my Muslim clients, and it was laughable because a lot of those concepts and a lot of that research never factored in Muslims to begin with. A lot of the research was done on, white Christian, people who are the primary population of the United States. And so finally, now they're increasing their research into the Muslim community. And there's a lot of really awesome resources that are specifically doing that I'm going to highlight at the end. One of the things I've seen Muslims experience, or a couple of the things I've seen Muslims experience when it comes to seeking mental health counseling is a lack of trust or understanding towards the counselor, bias about the mental health field. There's stereotypes about CPS and there's stereotypes about, racism that people have experienced, which are very real and are very real fears. But we're going to talk about that in a little bit. And then the big one that I've seen is fear of confidentiality. So the big thing to know about mental health in the United States is that it's regulated through the same laws as the medical field, such as like HIPAA, for example, which stands for this really long thing that I'm not going to get into, but basically ensures that you as a client have full confidentiality and protection of your information. There are a few places where that does not apply, and that is when if you disclose suicidal ideation or homicidal ideation, and if you are subpoenaed in a court, then that can, pose a risk to your confidentiality. But the most important thing to know is that your privacy and your information is protected in the United States when seeking mental health counseling, therapy, psychiatry, etc. So I just like to dispel that myth early on because that's one of the biggest fears that I see the Muslim community often experiencing is just fear that the information will get back to their families or get back to their communities, or that the therapist will somehow disclose what they've shared with other people. And that's just, it's not, unfounded, because I think in other countries and sometimes back home, there aren't these like very cut and dry understandings of confidentiality. But here it's really quite regulated, and there's a lot that can be done if that confidentiality isn't maintained for your protection. So here's some of the fun and confusing stuff. Here are some of the different types of licensure that you'll encounter. So I want to preface this by saying, like, counseling, therapy, there's all this end goal of like wanting to make sure that the client is working towards better and sound mental health. The degrees and the approaches that are taken are slightly different, but the end goal is the same. So even though there's all these letters and all these titles and all these names, I want you to make sure that you walk away with the understanding that the end goal essentially is the same. The practice, the therapy, the modality that's used, the way that they approach counseling or the way that they might approach therapy will differ slightly. So for example, I generally divide up types of licensure into two main fields, and there's counseling and there's medicine. And by the way, this is not even comprehensive. There's probably so many more, but these are the main ones that are most commonly known. So in counseling, you have people who have graduated with a degree in social work. And so you'd have a master's in social work, but then the license you have is a licensed clinical social worker. And if you have just graduated, it's a licensed master social worker. Again, social workers are generally, they have a broader field of what they're able to practice in. They can work in policy, and they can work in communities. They can work, directly one-on-one in counseling with, clients and patients. I do, but my training is a little bit bigger and a little bit broader than that. And the second one is, mental health counseling, just straight cut and dry mental health counseling. And so in different states, the acronym or the licensure may differ. So you may see LMHC. In Texas, you'll see LPC or LPC Associate. A thing to know is that these acronyms do sometimes vary by states, but I'm speaking specifically to what is more commonly seen in Texas. The third one is marriage and family therapy. So that licensure will look like LMFT or LMFT associate. There's also psychology, so clinical psychology, psychology in general. And there's two tracks that people will take. They'll either get a PsyD, which is a doctorate in psychology, or they'll do a PhD, which is a doctorate in philosophy. The main difference between these two is a clinical psychologist is more so trained to work one-on-one with clients, whereas a PhD is more so focused on research. You'll see both can work with clients, but this one's more client focused. I don't see any comments or chats, but hopefully this is not too confusing, but feel free to ask questions and I'll try to answer them if I'm able to. Another one is a national certified counselor. That's an additional step that not many people or not many practitioners take, but if you see these letters, it just means they've added some extra licensure to the end of their title. There's also a licensed chemical dependency counselor, which you technically don't even have to have any of these to be able to obtain, but they work specifically with substance use and substance abuse. There's a lot of different trainings associated with it, but yeah. So these are some of the more commonly known terms for licensure, and that would be for counseling. For medicine, it's a little bit more straightforward. So you either have, you mostly just have psychiatry or you have a psychiatric nurse practitioner. So of course, for psychiatry, you'll have a medical doctor or a doctor of osteopathy, MD or DO. And then for a nurse practitioner, ANP. And I think in different states, it looks different. The important thing to distinguish between medicine and counseling. In medicine, you are able to, and your primary job in the mental health field is to prescribe and manage medication for your patients. Counselors generally cannot do that. They cannot prescribe medication. They can recommend, they can work closely with psychiatrists or nurse practitioners, but their job is to work with the client or the patient one-on-one and work in a counseling setting, whatever that may look like, alongside the medication aspect of things. Okay. The other important thing to know, when I said that the acronyms sometimes differ by states, these licensures are regulated by state boards. So they're not regulated at the federal level. Every state has their own board that each of these people report to. Sometimes that makes it confusing, but the main important thing I want you to walk away with is what that means is that everybody who's licensed in a particular state generally cannot practice outside of their state. There's a lot of nuance to that statement, but that's why whenever I tell people to search for counselors, you should only search for counselors in the state that you reside in, because that is where they will be licensed. And we'll get to that in just a minute. Okay, so just a short slide about types of services. Again, different words that are sometimes thrown out there that may or may not make sense. Psychiatry. Kind of what I mentioned before is when you are, going through medication management or medication prescriptions. Some psychiatrists do counseling, but they are not licensed as counselors. They are licensed as medical doctors. I know that can be super confusing, but the easiest way to think about it is that psychiatrists are medical doctors whose primary job in the mental health field is to prescribe and manage medication. You may also hear the terms outpatient and inpatient programs, and this generally refers to hospital programs or behavioral treatment centers. Outpatient and inpatient, the main difference is that inpatient means that you will, essentially spend a lot of time there living there, like in a residential treatment facility. So there's differing, opinions and beliefs about whether inpatient versus outpatient helps more. But the thing to know is that outpatient means you just you come in throughout the day or the week to go to your services or your counseling sessions, whatever you need. For inpatient, it's like a more immersive experience because you're living there or staying there. This terminology is more commonly used for like substance abuse programs, for example. A lot of them will be inpatient. So you have people living together, doing groups throughout the day, throughout the week, eating together, doing activities together. And all that to say, these systems are not perfect, and there's a lot of work to be done in the mental health field. But generally, when you say inpatient, that's what it means. You may also encounter group counseling, which is a very, very powerful way to process your experiences with a lot of different people who may have similar experiences to yourself. So you'll see specific support groups or process groups for survivors of trauma or abuse, single women, divorced women groups. You'll see groups for people who may have personality disorders. You may see groups for people who are struggling with substance use disorders. So groups are just, lesser known, I think, in our community, but like slowly becoming more common and a more common way of, creating those support networks that you might need. And again, one of the biggest fears around group therapy, specifically for our communities, is confidentiality. Like if this is a Muslim group and our community is really, really small, how do you ensure confidentiality and that what's said in the group will stay in the group? When you zoom out and you go to the bigger population, it's a little bit easier to maintain that. But there are a lot of Muslim therapists who are starting to provide group therapy for Muslim clients specifically, and navigating the challenges that may come up with that. And then, of course, lastly, counseling and therapy, which is generally talk therapy. The sessions are around 50 to 60 minutes, and it's just the more traditional form of what we know as counseling or therapy. And again, these are not all like separate things. They can interchange or be intermingled. You can have outpatient programs that include counseling and therapy. You can have inpatient programs that are also including therapy. You can have groups that they're big, but they're also considered therapy. They're just considered group therapy. Again, this is a reason that some of these terms can sometimes be confusing, is because they're not all separate things. They're very much intertwined and interchangeable. And, there's a lot of overlap between these terms. Okay. Now, what to expect from therapy? Here in the United States, you will generally have more emphasis on talk therapy, and it's literally what it sounds like. It's usually 50 minutes, sometimes an hour and a half of therapy where you are conversing directly with another individual who's a licensed professional. And contrary to popular belief, you are not just talking to them, even though that's how it may seem, and that's how you may walk away from the session with. Therapists and licensed professionals are trained on how to specifically focus on problem solving, challenging problematic thoughts, and providing emphasis on validating what you're feeling or experiencing. A lot of the reasons that people go to therapy is because they are, experiencing or encountering a problem that they don't have a meaningful or logical way to solve. And so therapists are trained on how to, provide that kind of support to these clients. And providing them a space that is safe, but that can also challenge them in ways that they need to be challenged and work to problem solving as well. So therapists use many, many different styles and modalities. Some of the types of therapy below, for example, these are all just words if you're not super familiar with the fields, but if you want to do some research, I definitely encourage you. Some of the most common types of therapy are, cognitive behavioral therapy, which focuses on thoughts, feelings, and behaviors, and how to change your thoughts so that you change your behaviors. And specifically, under the umbrella of behavioral therapy. There's also solution-focused therapy, which is more so problem solving. There's person-centered therapy. There's also eye movement desensitization and reprocessing, which is a very, very specific kind of trauma therapy that looks very, very different. So most therapists will, kind of intermingle and interchange some of the types of therapy. You will very rarely find like a purist who like just does EMDR or just does cognitive behavioral therapy. They're oftentimes integrating and intermingling different solutions and different tools and different techniques into their practice. You will not notice it as the client, but just know that this is what's happening behind the scenes. It's also really, really important to find a therapist who is culturally competent. And cultural competence is even one of those terms that it's like, what does this mean? Like, how can you be competent in a culture? So the more common term that people are using now is cultural humility, meaning that as a therapist, you're willing to learn and engage with other cultures, other religions, and approach them from a non-judgmental way. There have been lots of horror stories of Muslim clients going to therapy and feeling extremely judged and extremely invalidated. And these are all real. I don't want to pretend like this doesn't happen because, the field of mental health is very new to really even training therapists on how to obtain cultural humility. And it's not something you can always teach. And so you either, find a therapist and we're going to talk about that in the next slide of how to even find a therapist. But it's generally, in my opinion, more helpful to find a therapist that already has that understanding of your background, your religion, your culture. And that includes finding a Muslim therapist. And alhamdulillah, like now more so, like the number of Muslim therapists in the field is growing. So it's really, really more likely that you'll be able to find that than maybe you were 10, 15 years ago. There are, of course, therapists outside the Muslim community who can perfectly work well with the Muslim community. Like I myself, I go to therapy and I'm not ashamed of it. I make sure everybody knows that, because as a therapist, I should also be going to therapy. And unfortunately, I am never able to see any Muslim therapists because I literally know all of them in our community. So I've been stuck with that problem. But alhamdulillah, like I've been able to find therapists who are outside the Muslim community, but who are very much in step with what I need. And are able to understand my baggage and my background and where I'm coming from. And, I don't have to spend so much time explaining, things about Islam or things about, our culture to them. And so it is very possible, all that to say, it's very possible to find a therapist who is not Muslim and doesn't come from the Muslim community, but you're still able to work with. But it may take some experimenting. So how to find a therapist? If that's something you're interested in or wanting to look into. The easiest resource that I always tell people about is Psychology Today, and that is a giant database of all the therapists ever in the United States. I think sometimes, no, I don't think Canada as well, but in the United States. And it has a very elaborate and extensive system of filtering, for what your specific needs are. So you can filter by religion, you can filter by language, you can filter by your insurance, and you should. So sometimes when you get on Psychology Today, because of how many therapists you'll encounter, it can actually be really, really, really overwhelming because there are so many of them, and you don't really know where to look. So one of the first places I tell people to, or one of the first things I tell people to do when they are looking at Psychology Today is start with, of course, the filter within your city or state. It depends on if you are looking for a in-person service or if you're looking for telehealth. So if you're looking for in-person, just start with your city as far as you're able to drive. If you're comfortable with telehealth, you can expand beyond the state. Telehealth options are really, really common now. And so you may actually have a better chance of finding someone you like if you branch out that far. If you have health insurance, definitely filter by health insurance. Health insurance can cover a big chunk of the costs of therapy. It may not cover all of it. For telehealth, I know during the pandemic, they were covering like 100% of it, which was really, really helpful to a lot of people. But it's important to acknowledge that not everybody has health insurance. Also important to acknowledge that not all therapists take health insurance, which can actually cause a lot of issues because therapy can be expensive. So one of the ways to navigate around that is to find free and low cost services in the community. And there's always nonprofits and different services that exist. It's more about just, finding, what unique resources exist within your community. But it can definitely be a barrier, as cost can definitely be a barrier. A lot of therapists are willing and able to work on a sliding scale. They may be able to negotiate with you if that's something that you propose to them. And if they don't take your health insurance, they can sometimes provide super bills for you to be able to take back to your health insurance. So just know that not having health insurance or a therapist not taking health insurance is not this be all end all. There are a lot of options that are available to make sure that, therapy doesn't end up, taking a giant chunk out of your budget. Other filters that you can use in addition to location and insurance also include, there's a religion filter on Psychology Today. Unfortunately, not many therapists list their religion, specifically even Muslim ones on Psychology Today. I don't know why, because, I think sometimes it's pretty obvious or visible, or it may be more helpful. But I always use the religion filter. I always tell people if the religion filter doesn't pop up anything, use language. So if you're looking for someone from a specific region, you can filter by Urdu or Hindi or Malay or Arabic, and those options all exist. And so religion and language are some of the two most helpful filters to finding a Muslim therapist, if that's something you're interested in. Sometimes if you have done a little bit more research and what kind of licensure you're looking for. Most people don't think about that. I don't personally think it's really as important, but sometimes that may be of importance to you. So I believe you can also just look at the initials at the end of the letters. I don't think there's a filter for licensure, if I remember correctly. But if you're looking for a social worker as opposed to an LPC, which is a licensed professional counselor, that will be pretty obvious on the page as you scroll through all the different options. The other important thing, as I mentioned before, always check within your state. So we're living in Texas. I assume everybody watching this is from Texas. If you ever decide to find a therapist or a mental health provider, always look within Texas. I get a lot of out-of-state requests, and again, there's a lot of misconceptions and confusion around like finding therapists out of state. Some therapists have different backdoor ways that they go about when trying to see clients out of state. It's not necessarily the best option, in my opinion. I think sometimes it's necessary, but it doesn't protect the client in all the ways that, they may need. So I've definitely had to do that sometimes. I know during the pandemic, some of the laws and whatnot relaxed. So a lot of therapists and clients were crossing those state boundaries, but a good rule of thumb is to always find someone within your state. And alhamdulillah, in Texas, there's no shortage of Muslim therapists, so you should be able to find someone. The other important thing that I really want to talk about is licensure in general as a whole. There are unfortunately therapists, counselors in the Muslim community who are calling themselves therapists and counselors, but don't have the licensure. And the reason I want to stress on this, is because every profession needs, some kind of gatekeeping. For the medical field, you can graduate and you graduate as a doctor and you have your MD, but you also have to do your residency and you have to take your exams and you have to be licensed with the medical board. This is very common. I mean, this is like everybody has heard of this. You have the same thing with dentistry. You have the same thing with nurses. For human-centered professions where you're working with people's lives, mental health is no different. And so you can get the degree, you can get your master's in social work or your master's in mental health counseling, but it is very important. And it's illegal to practice unless you don't have a license. But unfortunately, you have a lot of people crossing those boundaries. So the reason I'm emphasizing this is because if a person is not licensed and they're practicing therapy, they don't have liability or insurance. If they leak, your private documents or they breach the bounds of confidentiality, they're not accountable to a licensing board in any way. Like there's nobody who can hold them accountable. There's nobody who can take away their license because they already don't have a license. So it's important to maintain the integrity of the profession. And that's going to also come when people know what to look for and know that if you're not seeing someone who's licensed, they don't have liability, they don't have insurance covering their licensure, and there's no protection for the client in case, something goes awry. So make sure that when you are looking for someone, whether you found them on psychology, you have to be licensed to be on psychology today, but then there are therapists who are not on psychology today. And it's important to make sure you know what their licensure is and you can look up their licensure on the state board. Everyone's information there is public. So you can find, mine is 64313 on the Texas Behavioral Health Executive Council. So you can go find it. And if your therapist is not on there and they say they're licensed in Texas, that's a red flag. And that's not somebody for your safety and your benefit that you should be working with. Lastly, I've kind of hopped around a little bit, but MAPS is a really great initiative that I'm a part of, and it stands for the Muslim Association for Psychological Services. And it was formed because of this issue with licensure that we were seeing in the Muslim community. So it started out of Dallas, and now, alhamdulillah, we have an Austin branch. But it is a collective, a network of licensed Muslim therapists that network with each other and send each other clients and are referral sources, but is also a directory and database for the general Muslim community. So the website for that is going to be at the end, but it's www.mapsnetwork.org. And you can find the therapist in Dallas and in Austin, and I'm hoping we'll open like a Houston chapter soon. But it's a really, really awesome directory with so many therapists. And it's like, I didn't know how many Muslim therapists existed in Texas until I started recruiting everybody and trying to get everybody to join. But I think in the Dallas area, we have about 30, 35. Which is amazing. And then in Austin at the moment, we have 5, but I know that's not accurate to how many therapists are in Austin right now. So I'm trying to collectively, slowly bring everybody together and get them on this resource. But yeah, so there are actually, for Muslim therapists specifically, there are different websites pertaining to different locations. I think in the DC area, I think it's called muslimcounselors.org, and you'll find a listing of all the Muslim therapists. If you type in Bay Area Muslim therapist, there's a whole separate website for that. There's the Muslim Mental Health Directory, which I don't think is as comprehensive and updated as it could be, but there's a whole lot of different ones that exist specific to Muslims. So psychology today is not the be all end all. Thankfully, more resources are, being created and popping up, and MAPS is a great one that's local, that I definitely encourage y'all to bookmark, save, check out, etc. Oh, one more thing I forgot to mention, finding the right fit. It's okay if you find a therapist, Muslim, not Muslim, whatever, and you don't really click as much. People don't recognize that chemistry between, a therapist and a, client are actually really, really important. A therapist can have all the letters at the end of their name, all the trainings in the world, but if they don't click with you or they don't connect with you, you as a client are not going to benefit from that service as much as if you find a therapist who maybe doesn't have all the training, but that really clicks with you. One thing we're taught in graduate school is that the vehicle of change for a client is the relationship. So it's not about the training. So all that to say, you can find someone with all the different trainings and all the different letters, and several different modalities that they know how to work with. But if they don't click with you, then it's not going to mean much. So it's okay to experiment a little bit when it comes to finding therapists. If you're 3 sessions in and you're just not feeling it, let them know, and it's okay to find someone else. It's more of a waste of time and money if you just continue on with someone that you don't work with well, you don't really want to listen to, you don't feel inspired by, or you don't trust in the way that you may need to. And sometimes building trust is really hard, but trust also comes from like good chemistry. And if you already off the bat don't have good chemistry with your therapist, you probably should find someone else. And it's okay to do that. A lot of people experiment with therapists. It's encouraged, and there's no shame in it or nothing wrong with it. So I think we've gone almost 45 minutes and we're about at the end. Here are some of the resources that I recommend for, searching for like Muslim mental health resources. So the first, of course, was mapsnetwork.org, which is the one I recommended. I'm directly connected with it. I manage the website, I manage the membership. So if you have any questions, feel free to reach out to me about it. There's the Peaceful Families Project. There's the Family and Youth Institute. There's the Muslim Mental Health Institute, the Khalil Center, and the Stanford Muslim Mental Health Lab, led by Dr. Rania Awad, which is putting out a lot of really, really awesome research on Muslims in America and specific to their mental health. They came out with a lot of really, really fascinating studies recently. And so they're a really, really great resource to check out. Whoops. This is my contact information. I'll go back to the question slide in a little bit, but my licensure is LCSW. CCM, I did not go over CCM, but it's kind of like a little certificate, and it stands for Certified Case Manager. So just in case you are curious about those letters as well. My website is sarabawany.com. There's the mapsnetwork.org website with the listing of all the Muslim mental health, counselors and therapists. And then my practice's website is theimpactcounselors.com. And below is my email address for any of y'all to reach out if you have any questions. So I wanted to go back and see if anyone does have questions. This is the time to ask. I don't see any. Brother Altaf, I don't know if I'm like not looking in the right place, but I'm not seeing any questions. So shall we go ahead and wrap up?
Yeah, so Alhamdulillah, I think this is very informative. I personally gained so much of information from the session. I'm really impressed, and I think this is a great resource from our community. So Jazakallah khair for coming up with this. We probably need this in a big setting as well. But this is definitely going on YouTube, and I'm sure that people will really take advantage of the information that you have conveyed over here. And it will help even if we make a change or we basically address issues for even one community member. I think our time is worth it.
Yeah, absolutely. And thanks so much for having me. And I'm really glad this was beneficial, and I hope more people benefit from it, inshallah. It's so helpful to sometimes just break down these barriers that we have for seeking mental health support. And I know it's very confusing and there's a lot of information, but hopefully this helped bridge the gap a little bit, I hope.
Sure, sure. So Jazakallah khair, sister. And looks like we don't have any questions at this time. We will wrap up, and inshallah, this video will be available on YouTube. And we will basically put it, I will send the link to the community, inshallah.
Okay, inshallah. Thanks so much.
Thank you. Jazakallah khair.
Assalamu alaikum.
Walaikum salam.